Good morning, listeners and viewers out there. This is Sun FM TV. This morning, with Health Talk, we are going to talk about a disease called cervical cancer. I'm your presenter, Kenneth Safunda. With me, I've got Dr. Piri coming from Dora Teaching Hospital, and Dr. Kamisi also coming from the same hospital. Dr. Piri, good morning.
Good morning to you, Kenneth, and good morning to our viewers.
Dr. Kamisi, good morning.
Good morning, sir, and good morning, viewers.
Okay, as just from the sub title of our subject this morning, basically, Dr. Piri, what is cervical cancer?
So, cervical cancer is a cancer, or rather a disease, that affects the cervix, which would, in simple terms, call the mouth or the entry to the womb, the woman's womb. So, this is a cancer that is affecting the cervix, and is affecting quite a number of our women here in Zambia.
It doesn't affect men?
No, it doesn't affect men, because men don't have a cervix.
Thank you.
Yeah. So this is a cancer that is, if we look at our population right now, we're in and around 19.6 million people, and of that population, about 5.7 million women are at risk of getting cervical cancer. So this cancer is caused by a virus called human papilloma virus that is spread by sexual contact.
Okay.
Yeah. So every woman that is had a sexual encounter is at risk of getting cervical cancer.
Okay. Okay.
Yeah.
Now, Dr. Piri, how common is cervical cancer, especially here in Zambia and Africa in general, or maybe to the larger extent the world?
Yeah. So globally, it's number 4 gynecological malignancy affecting women.
Okay.
It's number 4 in the world. When we come to our local situation here in Zambia, cervical cancer tops the list. It's the number 1 cancer that is affecting our women. And if we go further, about 3,600 women every year are infected with cervical with HPV, which causes cervical cancer. And of that population, about 2,200 women are dying of cervical cancer every year. To break that down to a daily level, we are talking about 9 to 10 women being infected with HPV, the virus that causes cervical cancer, and being diagnosed with cervical cancer. And of that, 6 women are dying on a daily basis.
You said how many?
6 women every day are dying from cervical cancer.
In Zambia?
In Zambia.
In the world?
In Zambia.
It's quite threatening. Now, Dr. Piri, when we talk about cancer, do we have different types of cancer, or are all the cancers the same? Or what are the various types, especially in relationship to the subject that we are discussing this morning?
So, the cancer we're talking about specifically affects women. So in that context, there are various types of cancers that are affecting our women globally and in Zambia at national level. Various types of cancers. We have ovarian cancers, we have vulval cancers, we have endometrial cancer. There are quite a number. But of this list, the one that is affecting our women the most is the cancer we're talking about this morning.
Okay, but what do you think is the major, why is it affecting, is it so much as when you looked at the prevalences, and you highlighted on the death rates? I feel the death rate is quite too high. You know, look at our population, women population, and you said about 6
every day.
Are born every day.
Yes, so some of the major risk factors that predispose women to getting cervical cancer include, as I earlier mentioned, that this is a cancer that is caused by a virus that is acquired via sexual contact. So, and I must mention that the virus that causes cervical cancer is the most common sexually transmitted infection.
Okay.
Most common sexually transmitted infection. The virus also affects men, but more so to a lesser extent, but predominantly affects men, or affects women. So this cancer is this virus is acquired via sexual contact. So a woman who's predisposed to sexual engagement at a much earlier age is at risk of developing cervical cancer.
Okay, about what age?
Specific? So at whatever age, as long as a woman is exposed to sexual relations at a much earlier stage, we're talking about early on in their teens, they are at risk of developing cervical cancer. Other risk factors that would predispose a woman to getting cervical cancer include having multiple sexual partners. This predisposes a woman to acquiring various strains of the virus that causes cervical cancer. Low socioeconomic status, which is within which our nation falls. So a low socioeconomic status brings about concerns to do with hygiene, diet, and so on, that predisposes a woman to getting cervical cancer. Other risk factors would include prolonged use of oral contraceptive pills. So women who've used contraceptive pills repeatedly for a long period of time have a small risk of developing cervical cancer. Women who have multiple children are equally at risk of developing cervical cancer. Smoking.
Yes, especially for the women.
Especially women who smoke are also predisposed to developing cervical cancer. There are quite a number of risk factors that predispose a woman to developing cervical cancer.
Okay. Now, Dr. You said Dr. Your name
Dr. Khamis.
Dr. what?
Khamis.
Now, Dr. Khamisi, why
Yes,
is
sir.
it important for us to have an open discussion about the cervical cancer, so to say?
Thank you for that question. I think it's a very important question.
Thank you.
For most of our patients who do come to the hospital, you'd find do not know about cervical cancer. Even the young patients, because most of the time from where we work, you would find that even young girls as early as 14 or maybe even earlier are already sexually active, and they don't know what complications might come about from those acts. So for us to try and discuss this openly, I think is very important, because it will help encourage the women out there and also the adolescents to come and learn more about the disease and how we can help in that aspect.
Okay. Now, Dr. P, back to you now. You talked about the human papilloma virus that you have often mentioned. How is the HPV linked to the disease now?
Thank you very much. HPV is a virus, in full, as you've mentioned, human papilloma virus, that has been in existence as far as man has been in existence. So this virus belongs to a family of other viruses that affect not only humans, but affect other living things like cattle, dogs, monkeys, and so on and so forth. However, the virus is species specific. What I mean by that is the virus, the type of virus that affects humans has not been demonstrated to affect other animals. What you find affecting dogs is specific to dogs. What is affecting cattle is specific to cattle. So what we have affecting humans is specific to humans. And what this virus does is, in a way I would say, it is also trying to survive. And the virus cannot reproduce itself on its own. It requires human cells that it will use for its own benefit. In so doing, causing disease and ill health on our women.
Okay. Now, doctor, can cervical cancer be prevented by vaccination, and how?
Okay, thank you for that. So there are ways to look at this, and it's going to be different ways. So yes, we can prevent cervical cancer by vaccination, but that does not mean someone who's already got the cervical cancer is the one we are going to prevent it in. So as a country, we're trying to roll out a vaccine that we're giving to young girls aged 9 to 14 to try and prevent them from actually contracting the HPV, which eventually can turn to cervical cancer or can develop into cervical cancer. So something interesting that you would want to know is in the developed countries and world, they actually do provide this vaccine to both the male and female children. But unfortunately, looking at the cost and where we are at, we can only afford to give the girl child, who is mostly affected by the end disease process. So I think for those listening out there, the most concern we've received is over schools trying to vaccinate children and they ask for consent. I would advise the parents who are listening out there to actually agree to it, because it's something that helps and it saves lives in future.
Okay, thank you very much. Now, Dr. Pili, what are the common symptoms of cervical cancer?
Symptoms of cervical cancer include, but not limited to, perivaginal bleeding. So when a woman notices that she's bleeding perivaginally, now what we mean by this is women do have a period every month. Yeah, so now we're talking about bleeding that is a bit off and unrelated to a woman's period. So in the context of women in the reproductive age group, they will experience things like bleeding after being intimate with their partner. They notice there is a vaginal bleed, or they may notice a dirty, foul-smelling discharge per vagina. Those are indicators that there could be something wrong and they need to come to the hospital and be seen by a doctor. Women who have gone past their reproductive age, those who are postmenopausal, should not be bleeding. If they notice any type of bleed, they need to quickly come to the hospital for evaluation so that we see what is going on. And in this cohort of women who are postmenopausal, once they bleed, the most common malignant or cancerous cause of postmenopausal bleeding is cervical cancer in a poor country, or rather in a resource-limited country like ours. In the developed world, it's endometrial cancer that they'll be looking at. But in our context, the first suspicion is still cervical cancer.
Okay. So now, so you mentioned about vaginal bleeding. Should women, especially when they see that they have got like abnormal bleeding that they are failing to understand, you advise them to immediately seek medical care, isn't it?
Yes, yes.
Okay. So, this is what we are talking about is, sometimes women would say, no, me have just have bleeding in one or another, which is not consistent, or it's not in time with the normal timings. But I've heard women maybe approaching the health facility over that, because I've heard women, sometimes they just go and try to seek medication direct from the chemist. What do you advise them now?
I think that's a very important aspect. Yes, for those women who have irregular bleeding or bleeding in between their menses, the best thing, of course, is to come to the hospital so that we can evaluate and we advise on what it is that it could be. So if we can examine, do the proper examinations to try and see how your cervix is and how everything is. If everything is fine, we can reassure you and say, okay, maybe your period is not just regular and it happens at different times, and we might even be able to help with that. So in the event we find that it's a cervical cancer or what we usually term as pre-cancerous lesions, then we can advise and we can provide treatment accordingly.
Okay. Now, apart from the signs that you have talked of bleeding, what are other signs that women should be watch out for?
Okay. So something else is actually, so most of these symptoms and signs are dependent on at what point we're going to diagnose this cervical cancer. So if it's going to be a very advanced stage of disease, then it means these women are going to be in severe pain. So
Okay.
that might be one of the symptoms that they might come in with. They'll just come with a chronic back pain and it might need evaluation.
Okay. So what you are saying, cervical cancer comes with pain,
Yes, it does.
especially where definitely.
So yes, it does, and depending on the stage. So for you to start experiencing pain, most of the time it's already advanced, and you might have low abdominal pain or backache for most of the part. I think most of them complain of backache.
Okay. Now, Dr. Piri, sometimes symptoms can be confusing. How can women tell the difference between changes and the signs that need medical attention?
Okay, so, yeah. So as earlier mentioned, a woman who in a reproductive age group who encounters a bleed when she's intimate with her partner should immediately seek medical evaluation. Not only for cervical cancer, which is the primary suspicion in this case, but for other causes. If they notice any derangement or any abnormality in the pattern of their usual flow, they need to seek medical attention. We need to establish why the change in their normal menstrual pattern. We need to account for this new onset bleed that they are having now. What is the reason why they're having this bleed? So we need to be vigilant. Other symptoms that Dr. Kamisi has mentioned, like for those in advanced disease, because in the earlier stages of the disease, women may not experience pain, but as the disease progresses, they'll begin to experience low abdominal pain, they may experience back pain. You ask them whether they've been intimate with their partner, they'll tell you, no, it hasn't happened in some time. So it's leading you towards something, and you need to further evaluate.
Okay. Now, Dr. Kamisi,
Yes,
can cervical cancer be prevented? Or in an event where it's not prevented, can it cause death?
Yes, unfortunately, it does cause death, and as he mentioned earlier with the statistics, you have about 6 women per day in Zambia who is dying from cervical cancer. So when we talk of the prevention, yes, it is preventable.
So prevention can save, especially early detection and the prevention measures, they can save life.
Yes, definitely. So if these women are able to come in and we detect the disease process earlier on, there are things that we can do.
Okay.
So some of the things that we can do is we start with, of course, surgical procedures. So there are minimal surgical procedures, and then we can move all the way to major procedures. So when we talk of minimal procedures or the minor procedures, it means we can treat where the cervix is affected. So it's either we burn or we freeze or we can cut off, depending on, but that's for before you actually develop into a cancer. Then once you do have a cancer, what can be done is we usually remove the uterus here in Zambia for us to try and prevent that spread towards the rest of the body.
It's quite threatening anyway. What are the screening tests that are recommended for cancer, and how often should a woman get screened?
Okay, maybe if I can take up that one. Looking at the disease burden, WHO, World Health Organization, developed a strategy they're calling the Global Strategy for the Elimination of Cervical Cancer.
Okay.
Yeah, so in this strategy, one of the countries that have been recognized and employed in trying to expedite the process of eliminating cervical cancer happens to be Zambia. And currently there is a program that is running in 2 provinces, supported by some partner organizations like CHAI and Z, where they are helping us in accelerating progress towards this target of eliminating cervical cancer by 2030. So WHO developed a strategy they are calling the 90-70-90 approach. So it has 3 pillars, as I've mentioned. The first pillar is talking about us vaccinating 90% of our young girls between the ages of 9 to 14 with a vaccine.
But have we started that?
We are already doing that. That program is already underway, and I must mention that we are already at 63%.
Thank you. So, won't you achieve it by next year?
We are hopeful. There's still some challenges that are to be encountered along the way. So on that pillar alone, we're at 63%. And then the second pillar, the 70%, is talking about screening our women with a high performance test to detect the presence of the human papilloma virus. So this high performance test is a DNA based test. We're going what we're calling HPV DNA RNA test. And this requires special laboratory equipment for us to be able to screen, which the government is currently rolling out to most of the facilities.
So what you are telling me is that equipment, it's already acquired and it's just in the distributing processes.
Some of it is already there. I must mention that looking at where we are coming from, this cervical cancer prevention program, initially called, began in 2006 with only one clinic at UTH. But now we are talking about almost 365 sites countrywide.
But now let's talk of our own Ndola Teaching Hospital, so to say. Do you have that equipment?
Yes, we do have the equipment.
And it's in functioning?
Fully functional, and we're doing HPV DNA testing at Ndola Teaching Hospital. So
you are telling people in Ndola that, especially the women, that they should be ready to come for screening at any time?
We are encouraging them to come to Ndola Teaching Hospital Cervical Cancer Elimination Program Clinic. Every day, Monday through to Friday, we are open and we are screening our women. We're encouraging them to come. So we want to reach 70%, screen all our women for cervical cancer. And then, in addition to this, the last pillar is talking about treating 90% of women we find with a precancerous lesion or a disease process that has not yet become cancer. We screen those, and those that have developed cancer, like Dr. Kamis was mentioning, we provide them with the appropriate treatment. And on this one, I can also mention that with regards to treatment of those who have not yet gone into cancer, we are at 87%.
Okay, maybe just to go back to this question. Now, if a screening test suggests a problem, what diagnostic procedures are used to confirm so that the patient is aware that she has got cancer?
Yes, so that question just falls in line with what I was just currently explaining. Yes. So the screening method that have traditionally been there has been what we are calling VIA, which is visual inspection with acetic acid, which means we get a chemical called acetic acid and we apply it to the cervix and observe to see whether there will be any changes. So a cervix that is infected with HPV, and that HPV is causing changes on that cervix, you will see a whitish patch appear on the cervix. Then you know that there's a problem here, and then you provide the treatment modalities that Dr. Kamisi just mentioned, whether you either freeze, you burn, or you cut part of that cervix, depending on other criteria that are available to suggest what treatment option you provide for this woman. And then what we so that has been the traditional approach that we have used.
Okay.
But currently we want a more objective test. That's what we were encouraging to do now, once everything is fully in place, and it's already running in quite a number of facilities here in Zambia. What we are encouraging now is the use of HPV DNA RNA testing, where we advance a swab onto the cervix and collect some cells there or some fluid there, and then send to the lab. The lab is able to process and tell us to say there is HPV here, and they can further even tell us the type of HPV that is there, because there are so many variants as well, those that may cause cancer and those that may not cause cancer.
Okay, just as a follow-up question now, Dr. Piri, imagine today this woman moves into the hospital and tested that she's negative for cervical cancer. How frequently or when is she supposed to come back and recheck? Or is it a continuous process, or maybe just at once then she goes for good? What's the prevalences of them to be conducting a test?
Okay, so let me begin by saying we are beginning a screening for our women at the age of 25.
Okay.
And This is with HPV DNA testing, which is the preferred test. And why we're beginning at the age of 25 is the slow progressive nature of the disease process itself. On average in Zambia, most of our girls are engaged in their first sexual activity by age 15.
Okay. So
there is a window of about 10 years when we are likely going to see any change on the cervix. So the screening begins at 25 years of age with HPV DNA testing. And once a woman is screened with HPV DNA testing, when they come back depends on whether they are HIV positive or HIV negative.
No, but what I said, the question that I raised to you, doctors, in an event like, for instance, on Monday she comes for a test and found that she's negative, do you still encourage her to come back, or after maybe what period?
Okay.
Because, you know, some women would take it for granted that actually I went for cervical cancer test and I'm okay, now she has gone for good. After 5 years, 10 years, she will still be saying, no, actually me, I did the test and I'm fine.
Okay, I understand your question. So when a woman comes, we screen and we collect the results. We have the results now. Depending on what the results tell us, if the results say the result is negative, this woman goes home. If she's HIV positive, she'll come back after 3 years. If she's HIV negative, she'll come back after 5 years.
You advise them?
Yes, we give that information.
Okay.
However, if the result comes out positive, we have to look at other things. Now we do the very thing we've been doing in the past, where now that woman we subject at what we're calling visual inspection, visual assessment for VAT, what we're calling VAT, visual assessment for treatment. So we introduce acetic acid to the woman's cervix and see whether this HPV she has that has come out positive is causing any changes, so that it guides what we do thereafter.
So now, Doc, let's now talk about treatment now. What are the main treatment options available at the moment? This is a patient you have detected that she has got cancer. So what are the possible treatments that are available at the moment?
So when we establish that our woman has cervical cancer, the next thing that we do is we stage that woman. That's what will guide the type of treatment that we're going to provide. So most of the staging is clinical. It depends on what we see. We can run a number of investigations to support the staging. However, most of the staging is clinical. So we have stage 1, stage 2, stage 3, and stage 4. And each of these stages have sub-stages. So the early stages are amenable to surgery, meaning the early stages we can go into the operating room and do certain types of operation to achieve surgical treatment. But beyond a certain stage, we cannot operate. What will then be required is radiation and chemotherapy. What we call chemo radiation therapy.
But at the moment, are you able to do chemo in Ndola?
In Ndola,
because I just hear, no, this guy has gone for chemotherapy in Ndola, gone out, especially to South Africa or so, which I feel it's draining them a lot of finances.
I think Dr. Kamis can take that one up.
Yes, so unfortunately, as of now, we are not able to perform the chemo radiation because most of the time they go hand in hand.
But is it coming?
So, yes. So the good news is we do have a cancer disease hospital that's being established here in Ndola. And once that is done, we should be able to diagnose our own patients and treat our own patients here.
Okay, so you are telling the viewers out there that very soon we are going to have a cancer hospital in Ndola, where?
Towards the airport road, somewhere there, I'm not sure, but something is happening.
If I can just come in, as you are leaving Ndola Kitwe Road, you bypass Twapia. As you are heading towards the toll gate, if you look on your left, it's already at roof level now. It's over 70% complete.
Okay.
Yeah, and some of the equipment required for this hospital has already been procured by the government.
So what you are telling viewers there, that anytime soon they will stop?
Anytime soon. Most of the referrals we've been sending to Lusaka, we'll be doing it ourselves within Ndola.
Which is quite interesting. You know, patients can just be maybe they just say, no, it's a bit difficult, expensive also going to Ndola. Here's somebody who is coming from Chifubu without relatives in Osaka, admitted that I've been to cancer hospital in Osaka there before. My friend was admitted there. Unfortunately, he passed on. So I felt the process was quite tedious, because every now and then, I think every after a month, he needed to go back to Osaka. So I think it's good that the government has made a plan of, it has started actually, as you stated, that it's about 70% in almost the equipment is there. So they are just waiting for the hospital to be finalized. Now, finally, where can women in Zambia go for cervical cancer treatment?
So for treatment, currently, most of the...
Okay, let's start with screening, so to say, then from there we graduate to treatment.
Okay.
So screening, as I earlier mentioned, we are currently from one screening facility in 2006, we are currently somewhere around 365 countrywide. So for screening, there are so many
here
sites.
In Zambia.
Yes, that's Zambia.
Yes.
This is Zambia.
Okay, just to try to randomly mention them so that people can be aware. Those, especially those viewing us in Kitwe, those viewing us in Choma, can have an option of...
Very true, very true. So most of the major hospitals, most of the clinics are currently screening for cervical cancer. If I can pick Ndola as an example, I can run through almost all the clinics here and confirm.
Just give us an example of those clinics.
Ndola Teaching Hospital to begin with, Chipokota Mayamba, New Masala Clinic.
Chifubu.
In Chifubu, Chipokota Mayamba in Chifubu, Kawama Clinic in Kawama.
Level 1 hospital.
Chifubu level 1 hospital is screening. I could probably say most of our facilities on the, not just in Ndola but on the Copper Belt, are screening for cervical cancer.
Okay, so people are assured there. You just what do you encourage the women, especially Dr. Kamizi?
So to all the women out there, I would encourage that please come to the hospital or go to the local clinic if it's more comfortable for you, and you get screened. If they notice anything abnormal or something that they need a specialist to try and review, they'll still send you to the hospital and will be able to see and advise.
So maybe just to take you back, Dr. Kamizi, so do you expect any other woman just to move to the hospital and start to get screened for cervical cancer? Because some women will say, so what do you advise the women? They're out there.
So for most of the part, in the beginning of cervical cancer, or even before it develops into the actual cervical cancer, there are no symptoms. So you'll be feeling very fine. You'll be walking and doing your daily life, even exercising very well, and look very good. You cannot tell that this woman has...
The way you are looking.
You cannot tell if I have cervical cancer.
Okay.
So the whole idea is get screened early and we make a plan together.
Okay. So this is what you are saying. I think information is quite important. It's better how your health is going. Sometimes you just say no, but indeed we know, you just do all your daily activities. This is a Saturday, there will be a game there. So I think it's quite important that people could know, especially those diseases you are talking about that are so sensitive. It's the high time that women, they just wake up and say, no, I want to go and now, madam, in an event where a woman, or let me say a married woman, finds out that she has got cervical cancer, is it important to inform the husband?
Yes. So informing the husband
because
is one of...
I've heard of women, doing the treatment, but they are in a hiding mood. They don't want to know the partner, especially maybe confide herself with some few relatives.
No, that's a very sad situation, especially here in our country, because cervical cancer is one of those cancers that's even culturally very sensitive, because people would assume maybe it's different reasons that you have that cervical cancer. So people need support.
Okay.
Even the treatment process is very long. As we said, if we find it early and we can do a procedure just within the clinic, that's good. So meaning we try and treat and we review and see how we can move on. But if you have a cervical cancer, unfortunately, it needs a lot of support from family, especially the closest people like your husband. So it's important to share and see how you can work on it together.
Okay, now Dr. Pili, finally, you know, do you conduct any suggestive situations like where you sensitize people that they need to be coming to the hospital? Because of course I've heard about cervical cancer, but I've never heard of people talking that no, women are supposed to come to the hospital, this and that. The town is just quiet, but people are dying. So what role has especially your ministry and also your hospital has taken to sensitize people that they are supposed to come forth? Because I foresee you don't follow them into their homes, but are you conducting those sensitization programs?
Yes, very much so. And currently we have outreach programs on a weekly basis. Our nurses together with the community are in the community, and not only sensitizing the community, but carrying on screening services right in the community. We currently have a study that is ongoing where we're trying to see how well we'll do with the self-testing. So with the HPV DNA testing, the method that we are using can be administered either by a caregiver or by the woman herself. So a woman can do the test and then bring the sample to the facility for it to be run in the lab, for us to be able to establish whether she has the virus that causes cervical cancer or not. So sensitization programs are ongoing. We've had some talks, like I remember during the World Women's Day at Civic Center, we gave a short speech, we had a stand, and this is an ongoing activity. We've even actually gone further and had some webinars with the groups, where there are women's groups, where we share for maybe an hour or so online, since now people have access to gadgets that can connect us even at in different geographical locations. So that is something that is ongoing, and we are doing it on a weekly basis.
Okay, now we are coming to the end of the program. Dr. Pili and Dr. Kamisi, thank you for sharing this valuable information to us. You know, some people just take health for granted. I think to the listeners out there, you know, it's better you go to the hospital, get treated. Cancer, I think, is something that is preventable and treated. As the doctors with me this morning have assured that you can move to any health facilities within your reach. I feel at the moment now, almost some few kilometers, there is a hospital within your reach. I think it's better women get tested. They know their cervical cancer status, and I think it's better to start early than to be late. So this marks the end of our program. Dr. Pili and Dr. Kamisi, thank you very much. Until we meet again, bye-bye.
Thank you so much for having us.
You're welcome.
Thank you.